Hey, good afternoon, everyone. State Representative Emmanuel Chris Welch here. I'm actually coming to you from the state capitol, Springfield. I am still here. We had a very late night or early morning, if you want to call it. The Illinois General Assembly just passed the fiscal year 21 budget, and it'll be on the governor's desk very soon. Very happy that the legislature has come together and passed a budget that's going to help people all across the great state of Illinois. But I'm going to talk to you more about the budget in the coming week and give you some details on that. But today, as you all know, I'm having a very special edition of my Facebook Live conversations. And today I'm joined by Dr. Ngozi Ezike, a board certified internist and pediatrician. She is the director of the Illinois Department of Public Health. We've all seen her standing there daily with our governor giving reports during this COVID-19 crisis. Previously, she spent 15 years at the Cook County Health System. She is the former medical director at the Cook County Juvenile Detention Center, the largest site of its kind in the entire country. Dr. Ezike graduated with honors from Harvard College, and she has a degree in chemistry, a course I didn't do too well in. She has a medical degree from the University of California at San Diego, and she completed her internship and residency at Rush Medical Center, a very sought after residency indeed. So we are really honored to have her join us here this Sunday afternoon on Memorial Day weekend. Dr. Ezike, how are you?
I'm great. Thank you so much for having me. It's an honor.
Oh, my pleasure. My pleasure. We see you practically every day, but, no one gets to ask you, how are you? How are you doing?
No, I'm fine. There's a lot of important work that everybody has to be, all in on. And I just count myself amongst the people that actually have jobs, that continue to have jobs. And I'm excited to be able to work every day towards making the people of Illinois as safe as possible. It's an honor and a privilege.
Well, I don't think I've missed a briefing, and I've watched very closely, and I can tell your heart and soul is in the job. And some days it seems like it's tougher to say the things that you're going to say. And so I want you to know, as a legislator in the state and a resident of this great state, I appreciate the work that you're doing on behalf of the people of the state of Illinois.
Thank you very much. That means a lot. It really does mean a lot. Thank you.
I do want to get right to work, though. I want to ask you, what's the very latest? I know even though it's a holiday weekend, you're still tracking all of this information. What's the latest in cases and information?
Oh, yeah. So we had just over 2,500 new cases over the last 24 hours. Brings our total for the state of confirmed cases to over 110,000. And unfortunately, that includes 67 deaths that were reported to us over the last 24 hours, which brings us to 4,856 total deaths just in Illinois since this began. So we're still seeing fatalities, and we're still seeing increased cases. And again, just reminding people that the increased cases are a result of how aggressive we've been and how successful we have been in making sure there's widespread testing to everyone across the state.
So when you hear those numbers, lay people like myself and those who are listening and watching on social media, on television networks, they may not know what that all means. I mean, are we flattening the curve? Is it flat? Are we going down? What does all that mean?
Super important question. And it's true. From just hearing the numbers every day, it'd be hard to really piece that together. It sounds like we have tons of cases. Sounds like people are still dying. But when you look at it in totality, when you're looking at it from the beginning to where we are now, and you plot that over a curve, and you see the number of admissions that are going into the hospital newly, yes, we absolutely do see that we have flattened the curve, that we have way less deaths and hospitalizations than were predicted, again, largely because of the aggressive stance and the aggressive moves that Governor Pritzker made at the very beginning to close down bars and restaurants, to close schools, and to issue this shelter-in-place or stay-at-home order. So yes, we absolutely flattened the curve. We absolutely are in a better place than we would have been if those were not instituted. And so very proud of what Illinois has been able to do. And so that's why we don't want to undo anything that we've done, and we have to be very careful as we graduate into these next phases, if you will.
The governor announced this past week that the entire state is looking like next week we're going to be all in phase 3. And today he also announced guidelines for restaurants and businesses and workplaces to begin to reopen safely. And restrictions are being lifted. People can now go golf and tennis and eat outside. Can you tell us about that decision and how you guys came to that decision? Why now and why not 2 weeks ago?
Go ahead. Yeah. So again, as we, weeks ago kind of laid out the plan, we kind of laid out the timing in terms of how we would measure what was happening, and then figured out a time frame for when we should be able to make changes. And so May 1st was essentially the beginning of our phase 2. May 1st, there were some loosening of restrictions from the initial order that started the stay at home. So every time you make a change, you need to give yourself time to see the results of that change. So with May 1st, some things were relaxed. Additional businesses were allowed to do their, some curbside, elective surgeries were going to happen. So as you make those significant changes, you want to follow, at least, for a month to make sure that the trend from the results of those actions would not be something that was unintended, that would mean that you need to slow down. And if you open something up today and maybe it's going to result in a lot of infections, it's not something that you would see the next day or 2 days later. So it would take some time for any, consequences or new trends to develop. The time from maybe somebody starting to go out more to when they get infected might be 5 days or a week, and from getting infected to maybe getting hospitalized might be another week or two, and from getting hospitalized to unfortunately being in the ICU or even perishing might be another week or two. And so you have to give time to see, let's make incremental changes. So in case we see a trend we don't like, we know to either hold in place or even, unfortunately, if needed, dial back. So just trying to be very intentional, scientific, following what we're doing to make sure that we can catch any significant trends in the wrong direction before it got too far.
As we begin to open up in this new phase 3 next week, are we at our peak? Have we hit the peak and now we're past that?
Yeah, that's a great question. So again, some of the indicators and the information lag. Like you can't today, I know very well what happens maybe a week ago or even 5 days ago, but some of the data takes time to get logged in and for me to get all the reports and for everything, unfortunately, like death certificates to come in to see what the final numbers are. But it does look like we have hit our peak. And so hopefully, yes, we are on the downswing now. We definitely did advance into phase 2 a little bit before we got to that point. And so that's why we had to take such a cautious stance. But I think we're on the downward peak, but that could all change, obviously, if people's behaviors are such that it results in a lot more infection. So, everybody knows what to do and they can keep us on this downward peak, but it takes all of us to make sure that we stay there.
I'm here with Dr. Ezike, the director of the Illinois Department of Public Health. She is sharing some great information with all of us. Please share this with your friends so that we can bring in as many people to this conversation as possible. I am streaming this on Facebook and on YouTube. If you haven't subscribed to my YouTube channel yet, please go to Rep. Chris Welch on YouTube and subscribe to that as well, because it is a great source of putting out information as well. Dr. Ezike has been talking about us possibly on the downside of our peak. So Doc, I want to ask you, as we enter the warm weather, today is beautiful here in Springfield. We're going to be having a lot of this heat and summer heat regularly. Will swimming pools and water parks be allowed to open back up? My kids just learned how to swim.
Oh, congratulations to them. And my kids want to know that answer as well. And so we are trying to work both with the infectious disease consultants that have been working so closely with us, as well as the epidemiologists, and really trying to take a look at what's happening at other places that have already been open. We really just want to make the best decisions. And so we're trying to see what can be safely done and what precautions would have to be recommended in order to be as safe as possible. So we're working on that. We've been working on that through this weekend, and we're going to be able to give some answers soon. Don't want to get too far ahead of ourselves by saying too much now, but this is an important topic to so many people, to all of the state, as they think about how they will be able to enjoy their summer. And we, just like everyone else, want to have people enjoy their summer. So we're trying to find ways to do some of the things we're used to in the safest way possible without having too much additional risk. Everything besides staying at home involves some risk, just to be clear, but trying to figure out how to do things as safely as possible.
So if I heard you correctly, stay tuned. You're going to make an announcement about swimming pools and water parks?
Pretty soon. And, we're going to take things piece by piece, right? It's not just everything for everybody. So we'll figure out what we can do. And again, phase 3 might be one thing, and then, phase 4, another. So, bear with us. Believe me, none of us, everybody wants to be poolside. We all do. We're trying to balance that with our need to really stay safe.
In the Chicagoland area, a lot of our communities are right near the lakefront. They have beaches, and if local governments allow people to go to the beach, can they get in the lake and actually swim? Have you guys been asked that question?
Right. So we can put out our guidelines for the state of Illinois, trying to be consistent with Restore Illinois, but what actually happens in different municipalities where they have jurisdiction over the lake is actually their call. And so they can be more stringent than what the state guidelines are. And so, for places bound by, Chicago, they will decide, exactly what the actual regulations and rules will be for that area.
So phase 4 is actually even a little bit more open than phase 3. I mean,
Right.
You guys are, lifting the restrictions, piece by piece. So we'll all be happy to be in phase 3 next week, but when will phase 4 happen, and what will that look like?
So potentially phase 4 could be for 28 days or another 4 weeks from the beginning of phase 3, which looks good to be Friday for everyone. So 4 weeks from that, so just towards the end of June, that would mean group gatherings of up to 50, and more restaurants and bars being able to open in maybe a very more limited capacity, but more than just the outdoor seating that we'll see in phase 3. There'll be obviously more daycare. So just again, we want phase 3. Once we go into phase 3 next Friday, we've got to watch that very closely so that we can make sure that all these things that were opened up did not do anything to make us get close to, having, too many, hospitalizations, too many additional fatalities, get close to overwhelming our healthcare system. So we're going to watch that very closely and make sure that those parameters are still trending in the right way. Like, we've seen hospital admissions going down for the last, 3 to 4 weeks. Like, we don't want to see that trend up again, or else we don't move on to phase 4.
So if I'm listening to you again carefully, 4 weeks from Friday, If things go well, we can be in phase 4. And if I saw the guidelines correctly, phase 4, schools can reopen in phase 4. So that means we are theoretically on track for schools to open up in the fall. Is that correct?
There were some guidelines. We didn't have anything for summer school to open per se.
Right.
We are hoping that schools will open in some fashion. We already have all the colleges and university, the State Board of Education. They're already working on plans. It won't look even if things are going well, and it won't look the way school looked in January or 6 months ago. But we want to figure out what that new type of schooling will look in this world where we are coexisting with COVID. And so I know some of the best educational and planning minds are trying to put that together. And again, as we cycle through, we will be able to see what that needs to look like. And hopefully we'll also have some clues from other people in other parts of the world. Putting all that information together, we'll do the best that we can to keep the people of Illinois safe, including our little ones and the ones who instruct them.
Absolutely. If schools are open in phase 4, when you hear school is open, will that include in-person learning? Will kids be allowed to go back, and even if they're sitting 6 feet away? I've been seeing photos out of different countries where they have on hats with noodles or something to keep them 6 feet apart. I mean, will they be allowed to go back to in-person school?
Yeah, no, I mean, it could be some kind of hybrid. There's also a lot of concern, as you know, about the thought of will there be some kind of peak or resurgence in the fall. And so we're very sensitive to that as well, especially with flu season being overlaid on top of the possibility of a COVID resurgence. So a lot of things to consider. We're going to have to be very nimble and very agile and be able to respond to what's happening. Again, not being able to know exactly what's going to be happening makes it a little bit hard to plan. But even if we do plan, we have to be able to have contingency plan A, B, C, D, all going down for all the possible things that might be thrown at us. So again, we are going to be following the data. We're going to be following what other people are doing, what works, what doesn't work, so that we can try to make the best plan, but even with the best plan, be ready to adjust that plan if necessary.
So who are we? Who are the people that are sitting around that table advising the governor on what he should or should not do? Go ahead, Don.
Sorry. Yeah, no, he's getting inputs from so many people. Some of them are sitting directly around the table. Some of them are not. We obviously have, the governor's office team. We obviously have, the epidemiologists. All of public health. Public health represents so many people. It's the statisticians. It's the epidemiologists. We have infectious disease consultants. We're working with modelers. We're looking at policy with policy people. So it's just and then when you start getting into the individual specifics of, what about for this sector of the economy or this sector of the community, bringing in those experts and representatives from those experts to give their feedback, so that it's like bi-directional, thinking about what's best and what's feasible and what can work and what could not work. Really just trying to see if you can get enough participation from the different people so that when you actually have a plan, that it actually works and that it actually is something that can be implemented and that can work for all, both the user and the business person, and that hopefully the science people will see the right results at the end of making those plans implemented.
You really learn a lot about a person when you're working with them in a stressful situation. And I would consider working during a global health crisis as a stressful situation. How is Governor J.B. Pritzker to work for? What's he like? Tell us a little bit.
Yeah. So it's really an honor to be able to work with him. I think some of the biggest takeaways is that, as hard as everybody's working, he's working just as hard, if not harder. Get texts and calls from early in the morning till late at night. He's working all the time. He's thinking about this all the time. I think he wakes up trying to understand, like, how many people lost their lives? How many reports did we get? How many people were diagnosed today? He starts off with that. He's a very principled person that really believes in science, and that is such a big deal. That is what led him to make these really gigantic, momentous moves that have really literally saved thousands of lives. And Illinois will forever be indebted to him for that. Again, we were just the second state in the nation to implement our stay-at-home order. And the earlier that we were able to do that is just, I can't even explain. If you look at the models for where we should have been versus where we are now, absolutely the governor can be credited with saving so many lives. So, being a hard worker and following science, he's mastered so many of these epidemiologic principles. He's mastered what's involved in testing. So it is great to work with someone so knowledgeable, so hardworking, and willing to follow the science. It really makes for just a tremendous leader.
Just like yourself, some days when he's standing at that podium giving his daily briefing, I could really feel the emotion that is going through him at the moment. And he really is passionate about the work that you all are doing. He's been talking pretty regularly about this constant contact tracing program. He mentioned it today at his press conference earlier today here in Springfield. And the budget approved over $900 million for this program, almost $1 billion for contact tracing. Tell us about that, and how close are we to getting that up and running?
Yeah, so another big project, obviously, that we've been working on nonstop every day, multiple meetings a day trying to get that. So just to be clear, contact tracing is something that already exists. Contact tracing forms just the bedrock of disease investigation. It's been used for HIV. It's used for any kind of sexually transmitted infection, any type of infection at all. So it just means that if you identify a case that has the disease that you're looking for, that you have to interview that person. You have to identify that a person has been diagnosed. And then once that person has been diagnosed, you need to be able to reach out to that person and ask the right questions, have a very structured interview to identify all the people that person could have come in contact with, so that those people can be immediately notified. As many people might know, that if you have been exposed to an individual who has confirmed COVID, you obviously are at risk for manifesting the symptoms after maybe potentially getting infected yourself. And so you would want to stand down, like you would want to be in a self quarantine, if you will, for at least 14 days, because it can take that long for your symptoms to develop. So obviously if a person is ill and they just keep going about their regular business, they will keep infecting people, and those people will keep infecting people, and the infection will never cease, and the rates will continue to go up. But with contact tracing, you identify who was positive, and then you have that person, go into isolation, and they stay there until they're fully recovered. But you've identified their contacts and now have told them you have to stand down so that you don't risk spreading it even before you know you have it. And then that really helps stop the infection in its tracks. So if you can aggressively do that for every single case that's identified, you will stop or halt transmission, eventually to the point where you don't have a lot of cases of people saying, gee, I got this infection and I have no idea where I got it from, because you'll get the numbers down and every case will be, tied to just one or two people that you know. And so we want to really get this robust contact tracing. It's going to take a lot of people because that's a lot of, depending on what I've been doing, there could be many, many contacts that I've had while I was infectious. And so being able to contact all of those people and then also monitor those people daily, just a non-intrusive call, saying, okay, checking on you. Are you developing symptoms now? I know you were exposed to someone who had the disease, do you have fever? Do you have a headache? Do you have any of these symptoms? And then, ushering them, quickly to get tested. So having the testing, being able to follow up with people, being able to identify people. If you can't find them by phone, you might have to have somebody go track them down in the community just to make sure that they're okay. If people say, well, I'd like to isolate or quarantine, I've got all these people in my house, could I potentially infect them? Then creating actually resources so that they can go somewhere safely to quarantine. And then that place that you shelter them in, that you have, food and everything they need so that they don't have to run out to the store or run around to other places and then, defeat the purpose of the quarantine. So having all of those services is a big undertaking. We've done it in a small amount, but with the large number of cases, couldn't get everyone. But the goal is to get everybody contact traced and followed and supported and given the resources they need to stay sheltered so that we can eventually just really nip this in the bud.
Hey, Doc, I see I only have about 4 or 5 minutes left, and it's holiday weekend. I want you to enjoy as much of it as possible. Just a couple more questions. People are out there having barbecues this weekend, today and tomorrow, I'm sure. I just saw on Twitter, folks in the Ozarks having pool parties and things of that nature. What would you say to people who are out there hosting, big gatherings this weekend already?
Yeah. So I mean, at the end of all of this, we want people to be safe. I mean, that's the goal. Nobody is trying to punish people or suffer people. We want people to be safe and we want to minimize the loss of life. And with this virus that is obviously invisible and you don't even know when you have it, and we're learning that maybe 30, maybe even 40% of people can be spreading the infection without even knowing it. Just want people to try to do physical or social distancing as much as possible. I mean, you have to try to think about the health and safety of all the people of Illinois. So the mask is, I think, a simple ask that really decreases transmission of the infection. So wearing masks as much as possible, keeping that 6 feet of distance, washing your hands. We have to follow these principles. These are the only ones that we have that will really stop the spread of the virus. So I'm urging people to pay attention. It's not about me. It's not about Governor Pritzker. This is the science that works to help prevent transmission of infection. And we know that we have a serious infection on our hands. Just look at the almost 4,000 people in the hospital right now. They are fighting a real infection, and the over 4,000 people that have lost their lives, they had a serious infection and lost their fight with COVID.
How long should we continue to wear these masks? Till phase 5? Is that the recommendation?
I would say until we knew that if you got sick, there's an effective cure that could decrease the risk of people dying in the numbers we're seeing. Absolutely. I know in other countries that has been just a regular part of life for a long time. And we've kind of looked at that and not seen why that was happening. But I think we all see now, if we know that this can significantly decrease infections, that's the goal. So I think we got to get used to our mask and get some nice ones made, maybe reflecting our favorite teams or whatever our passions are. But yeah, I think masks need to be our friends.
Well, I see we have only a minute left, so I want to ask you this question. As we head into phase 3 and hopefully phase 4, 28 days after that, what are you looking forward to doing as we kind of open things back up? I hear you're a great tennis player. What are you burning to do?
No, I love tennis and really haven't been able to play as much. Been working really hard, so there really hasn't been the time. But I am looking forward to trying to get on the court and play some tennis. The COVID-19 was named for the year that it was discovered, but I'm developing a COVID-19 in terms of poundage, so I need to try to reverse some of that. And I think going onto the tennis court and smashing some balls will, in a socially distanced kind of way, of course, will be a great way to release some of the tension and then get some of this excess luggage off.
Indeed. I'm looking forward to getting home, seeing my kids, and riding my bike. We all went out and bought bikes, and so be able to just get out and enjoy this outdoor weather, consistent outdoor weather.
Yes, right. Oh, say hello to them.
I will do. Well, Doc, I see I'm out of time, and I just appreciate you taking time on a Sunday afternoon, a holiday weekend, to continue to do what you do and get the information out there. Thank you. Enjoy your family, and we'll continue to follow your advice. We'll stay home. Stay safe.
Platform. Thanks for using your platform to spread such important information. It's an honor to be with you. Thank you so much.
Thank you, Doc. Appreciate you. Stay well.
Thank you.